Deborah Quilter, and welcome to RSI Help YouTube. I was once having a really fascinating conversation with Jim Harwood. He's the co-owner of New York Physical Therapy and a physical therapist who specializes in osteopathic manual practice. We were talking about RSI, and he was talking about the breathing, the apparatus of breathing, the diaphragm, the way the muscles are connected. And I wanted so much at that time to have everyone in the world hear what he was saying. So today we're lucky enough to have Jim Harwood right here in our studio to talk to us. So welcome, Jim. Please explain this fascinating connection between breathing and RSI. And it sounds like if you could improve your breathing, you could reduce a lot of symptoms and improve your whole upper extremity.
Absolutely. Deborah, first of all, thank you for inviting me. And I'm hoping that, I can shed some light and help your clients, my clients, or anyone who might be happening to listen. Just to get started, I mean, the word in the exact diagnosis kind of gives a hint to where this might be going. Repetitive stress injury. I mean, the word stress is in there. And when you understand how breathing works, and not how it works per se, but what the impacts of proper breathing can be, or corollary, what the impacts of not breathing properly, what can happen, you start to understand why this would be beneficial, not just to RSI patients, but to anybody, really anybody. I've written a couple of articles on this, and one of the phrases I've always loved, rehashing is, in the East, Hindu, Buddhist, whatever, there have been different quotes that I read that, they believe if you breathe properly on a consistent basis, you will have, you can, not necessarily cure ill, but you will prevent getting sick and being ill more times than not. But specifically to this, and actually it's funny, Deborah, when you talk about this, I do remember that day, but a lot of when I answer questions to people, a lot of times whatever's happening at the moment kind of just, it comes together. I hope it comes together now, but the best way I can describe it is to bring it in connection to the autonomic nervous system. We live in a world so much predicated on stress and strain and doing and going, that we tend to be in what we call a sympathetic prevalence in our autonomic nervous system.
Jim, before you go on, let's describe the autonomic nervous system so people understand. This is what happens by itself, right? You don't have to think about it.
Right, exactly. The autonomic nervous system, we don't control our heart beating. We don't control our lungs. We don't, we do control our lungs, but we don't control the way we digest. And, there are different types of nervous systems where we can describe everything. The autonomic nervous system is a system that works without our input per se. And there's two components to it. There's the sympathetic and the parasympathetic. And what's important to us is to understand that the sympathetic system is the system that we use when we're stressed out. It's the fight or flight system. And the parasympathetic is the, rest and digest. But the key component here is, and what I think brings it back to RSI, is when we are in the sympathetic mode, the goal of that system is to allow us to deal with stress and strain. The blood gets shunted to our muscles, to our breathing, not to our digestion, not to a lot of other things that, at other times may be very important. It's really there for us to fight or flight. And in that mode, it's really like crisis mode. The body is not concerned about healing or recuperation or relaxation, all the components that are necessary for us to heal ourselves. Because, fundamentally, I believe, and I'm sure you, Deborah, too, that we all have the ability to heal ourselves. If we are always in sympathetic charge, it's just not, you're not capable, because the body is not, when it's in sympathetic overload, or when it's in the sympathetic role, that is not part of the goal and mission of the sympathetic system, is to worry about healing. Because, it comes back to our, cavemen. Like, it didn't matter if you were digesting a meal as a lion was eating you. I mean, it was more about using the resources to get away. Unfortunately, that same system exists, but we can actually cause some of those same responses just by thinking, sitting on a computer for a long time, doing, do computer work and all that. So we have the same response in our system that we might have had as our ancestors did when they were being attacked by a lion. And again, just to reiterate, when we're in that system, we don't have time to heal. So what does breathing have to do with it? Well, breathing, should I continue on or should I take a breath
Yes.
there? Well, breathing is certainly one way of allowing our body to balance out that system, right? So um, a lot of the literature, and you can find many, many resources that'll tell you when we start doing deep diaphragmatic, conscious, focused breathing, our body automatically gets the trigger to relax the to turn off the sympathetic chain response and allow the parasympathetic to come in. Once we're in that mode, we allow our body to heal. That's one reason why it helps. Two, yeah, I'm sorry, yes.
There was another connection that I thought was fascinating too when you were talking about the muscular attachments.
Yep.
Because if you're doing um, the short breathing, the upper lobes of the lungs, your muscles are contracted. But if you're doing a relaxed diaphragmatic breathing, the muscles of inspiration, I forget what they call them, the accessory muscles of inspiration aren't working so hard. And I think you had mentioned some.
Absolutely. I mean, you're right. I mean, when we're doing diaphragmatic breathing, it is the autonomic system working. It's simple. It is our mind is not involved in it. When we're doing short, when we're stressed, or when we're doing other things, we do a lot of work with our accessory muscles, and our accessory muscles are muscles that attach from our ribs to our neck. They're not the diaphragm, which is our main respiratory muscle, which will work on its own. When we start working with the accessory muscles, the upper traps, and anything attaches to the ribs, yes, exactly right. You can start causing a whole problem with the upper quarter. And why that's really important, and I think this might be the connection you were talking about, is this is what we call the thoracic inlet. In that area are a lot of important blood vessels, and also what's in there is what we call a lymphatic system. So we know that when we're stressed and when we have repetitive strain injuries, and I always seem to go back to the wrist, but I think low back is a repetitive strain injury too. But when we have that, we have a chance of having a lymphatic backup if we have a lot of tension in thoracic inlet, right? Right behind both clavicles, right in that area is where our lymphatic drainage occurs. Oddly, it's kind of I believe, an anatomical kind of, there's a huge anatomical asymmetry to our lymphatic system, and it's kind of wild. Our lymphatic system from our feet all the way up to our heart, that's the extracellular fluid, right? The fluid outside a cell. That fluid gets back to the heart via the lymphatic system. So all our legs, all the right side of our thorax, and our whole abdomen, our whole right arm, the right side of our head, all drains behind the left side, drains behind the left clavicle. On the right side, only the arm, the right side of the head, and part of the thorax. So it's kind of strange. So, but getting back to the link, if we have tightness in here from accessory muscle work, from improper breathing, we have the opportunity to block those channels. And anytime you block lymphatic channels, again, go back to not healing properly, not allowing the body to work the way it's supposed to. The originator of osteopathy, his name was Andrew Still. His whole mantra, one of his main mantra would be that life is about movement. And that means all types of movement, right? The heart moving, the lungs moving, your mind moving, and blood moving. Anytime we have any stagnation at any level, you have an opportunity for disease and non-repair. If that makes sense.
The other thing that I've noticed is that if you have this kind of tension in your neck, this kind of stagnation of movement, you can't use your arm properly. Your arm really if you want to make a full range of motion with your shoulder and your neck is tight, you really cannot do that. And that would lead to other cascading problems down the upper extremity.
Absolutely. Yeah. I mean, you can only be strong distally if you're strong proximally, right? I mean, you can't have strong hands and wrists if we're having issues up in our shoulders. And you're right. If things are not working right here, it just can't work down at the lower part of your extremities. You're right. I mean, so there's a lot of connections why breathing is so important to anybody, but specifically RSI patients, for sure.
So the breathing would help the lymph to
Correct.
flow.
So, well, actually, the only way the venous system and the lymphatic system, it has no muscles in their highways, so to speak, right? The way you return those type of fluids back to the heart, and usually against gravity, because most of the time we're moving around and we're upright, is through breathing. Actually, from our breathing and muscle contractions. But breathing is a huge part of the
Wow.
return. And also, when you talk about anatomy, we got to also understand that the lymph channels, the vagus nerve, which we haven't even talked about yet, which is huge in this, the esophagus, the aorta, all these very important structures actually pierce the diaphragm. So when the diaphragm is moving properly through its normal range of motion, it has a chance to actually massage and move fluid through those channels. So again, if we're not breathing properly, we have the opportunity for that normal system to not be working right and be dysfunctional. So there's so many connections to proper breathing. And again, not just RSI, but just overall body health, right? Like if we wanted to summarize them again, the balance of the autonomic nervous system between the parasympathetic and the sympathetic. And I didn't even get into the vagus nerve. The vagus nerve is a cranial nerve that comes out of your skull, through your neck, down through your body. It is the main parasympathetic nerve of the body. It pierces the diaphragm along with the esophagus, and it goes to all your abdominal organs. So if there's any issues with improper breathing, where the sympathetic system's charged up and we're not breathing right, then the vagus nerve is dysfunctional. And then you have potentially nutritional issues, which again can come right back to RSI, right? I mean, if we're not eating right, we're not feeding our body right, we're going to have problems, potential for problems. So there's so many things.
Don't they call that the second brain?
They do. They do. What they call the abdomen, the digestive system, the second brain. And one of the many reasons why is the fact that the vagus nerve is involved in digestion and many other organ work. But it is the main parasympathetic nerve in the body.
So what's fascinating to me is these interconnections. I mean, you're the first person that I've spoken to that's talked about the lymphatic connection and RSI, but there's all these other things, the way that the nerves are connected. And if you are still enough, I'm a yoga teacher and practitioner, so when I'm very still, you can almost feel the cells breathing, expanding and contracting with the breath, which allows the nerves to have a little room to breathe. Because I think they are also breathing in the sense of movement, that gentle contraction and expansion. Correct me if I'm wrong.
Absolutely. I mean, again, when we talk about movement, there is an inherent movement within the body, right? There's a breathing of the diaphragm. Now, this is osteopathic thinking, so maybe not everybody would subscribe to this, but there's no doubt in my mind that every living cell has a breath of its own, where it's expanding and retracting, right? So if you believe that the nerve is made up of cells, absolutely, you have that potential for that breath. So if anywhere along the chain there's any potential for stress, strain, or dysfunction, then it's not going to have that. It won't be as healthy, and it won't be offering its best. And believe it or not, a lot of this we're talking about, and I know it's a lot of information and a lot of words and all, but to simplify it is, if people learn to breathe better and properly, they have a chance to allow all these different connections to work a lot better. The other thing you brought up earlier, which I, again, connected to the vagus nerve, if we have a lot of tightness in here from posture as well as improper breathing, we will have an impact on the vagus nerve as it exits the skull and goes through the neck. So here's another connection that's different than all the other connections we're making about the vagus nerve. But if there's a lot of tension a lot of people get a lot of tension in the back of their necks and in the bottom of their skull, if there's a lot of tension there, that in and of itself, if it impacts the ability of the vagus nerve to work properly, there you go. Now that could be the beginning of improper breathing.
But what about forward head posture too? Because that's the big culprit.
Right. Exactly. When you have forward head posture, that causes a lot of stress and strain at the bottom of the skull and the top of the neck. And that happens to be exactly where the vagus nerve comes out of. The vagus nerve exits the skull between the occiput and the temple bones on both sides, which is right there. So if you, I don't know if you know your mastoids. Some people know where their mastoids are. Well, that's really where it is. Right in there. Yep, and that's where the vagus nerve exits, along with the external jugular vein. So I mean, that hole in the skull between the temple bone and the occiput is so important. I would say 95%, maybe 100% of patients that I treat, I'll always check that connection, whether they have an ankle sprain, whether they have RSI, whether they have a cranial issue. I'll always be checking their OMs, which is that joint, because just specifically so that hole is what the size that it should be, so it doesn't give any extra pressure onto the vagus nerve and any other structure. So there's so many connections. And I know this may get a little, maybe it's too much, but at the end of the day, I think the point of this is just to try to give people a reason to understand why proper breathing is so important to, again, preventing or helping heal RSI, and many other things in your body. So.
Well, I want to thank you for coming on the show and explaining all this in such incredible detail, Jim. This has been really fascinating. And I hope you will come back and talk to us again about maybe the cranium. We'll work on that one.
Absolutely.
But in the meantime, if people want to find you, they can go to your website.
Correct. Yes. It's www.nypt, and the word healing, HEALING.com.
Thank you. Thank you for coming on the show, Jim. And thank you all for watching RSI Help YouTube. We'll see you next time.